Hello everyone, my name is Dr. Ourania Varsou, and today we will be exploring the ultrasonographic anatomy of the area of the neck. Specifically, we will be scanning a volunteer's right side of the neck. And in terms of orientation, I would like you to, when you're looking at the scans, the more superficial, so the most uppermost part of the screen is towards the skin. And as the sound waves are progressing through the different structures of the neck, we go into deeper structures, which will be towards the bottom of the screen. So towards your keyboard, if you're looking at the scans on your laptop, for example. In terms of medial and lateral, because this is the right side of the volunteer that we are who has very kindly agreed to be scanned, you will have to orient yourselves in terms of the lateral and the medial. So on the screen, you will see that we have a panel on your left-hand side of the screen. That is the lateral side of the scan. Whereas the opposite side, where we don't have the panel with the different functions, is the medial side. So in the medial side, we will be looking at the thyroid, and then as we move more laterally, we will notice superficial the sternocleidomastoid, and then underneath that, the neurovascular structures that we will be looking at. So here we can see the right side of the volunteer that we are scanning. The first thing that I would like you to notice is, first of all, we are at the root of the neck, and we notice in the center of our screen the common carotid artery. More medially, we will start seeing the beginning of the thyroid gland, and as we move more medially now, while we're scanning, we notice the larynx. And of course, the larynx, because there is air, we won't see any sound waves passing through air. Air and ultrasound do not work well together. Again, more superficially, we will notice the isthmus of the thyroid gland, and anterior to that, we can see some of the strap muscles as well. We can see the thyroid here on the right side of the screen, and more laterally, we can see the common carotid artery. And slowly we can see that pulsating as well. Now we have moved more laterally away from the thyroid gland. In the center of the screen we can still see the common carotid. On the top left side of the screen we can see the sternocleidomastoid muscle. And here we see the volunteer performing the Valsalva maneuver with the internal jugular vein expanding, which is lateral to the common carotid artery. And that has disappeared now as the volunteer is breathing normally. We can see here again the common carotid more to the right side of the screen, more medial, and we can see the vagus nerve that just appeared right there. We have the sternocleidomastoid most superficial at the top of the screen. And we can see again the volunteer here performing the Valsalva maneuver with the internal jugular vein as we have moved slightly upwards from the root of the neck and that vein expanding. Now we have put the color Doppler and we're moving the screen so we can see the different blood flow between the different vessels. As we tilt the probe towards the heart, we can see red for the artery, which is the common carotid artery, and that is blood flow towards the probe. The rest of the color we see within that window for the color Doppler is just artifact from movement as the volunteer is breathing. Focus on the red, which is the common carotid artery. And again, the volunteer here is performing the Valsalva maneuver, and you can see very nice discrimination between the blue and the red. Blue for vein, blood away from the probe, and red artery, blood towards the probe. So following the color Doppler, we can also do pulse wave. And in this particular case, not only we can see the pulsation, excluding the color, of course, but we can also hear the pulsation. So in this particular case, I would like you just to look at the bottom of the screen, and when the cursor is in the center of the common carotid artery, which is right there actually, we can start from this point onwards to see the pulsation on the screen. And this aligns, if we were, for example, to time this, it's a very nice pulsation, we can see it's regular. We can actually time it with a volunteer's heart rate as well. And this is another way to distinguish between an artery and a vein, for example. So we can use, first of all, things like the Valsalva maneuver, then color Doppler, and then the pulse wave too. Here we have applied color Doppler, and we can see the bifurcation of the common carotid into the external and the internal carotid. Again, we're tilting the probe towards the heart, so the flow towards the probe is red, which is your two branches of the common carotid.